Welcome everyone and greetings from Brooklyn. I hope you're doing well. My name is Michael Grilla and I'm the president of the Society for Health Communication and the head of reputation and social impact for Evoke Kind, a global health communications agency. The Society is delighted to be partnering with NORC at the University of Chicago for our second webinar of 2023, Communicating Through a Pandemic, a fireside chat with Dr. Amelia Burke-Garcia. In addition to our discussion today, we'll be raffling off 3 signed copies of Amelia's book, so stay tuned until the end for your chance to win. Very briefly, I'm going to share some background on the Society, go through a few housekeeping items, and then we'll go ahead and get started. Next slide, please. The Society for Health Communication was established in 2016 to help unite professionals from across the field of health communication. We're now nearly 4,500 members strong and growing, working to share resources, exchange best practices, and advance the evidence base of the field. Now more than ever, our work together is critically important. So if you're not already a member, we encourage you to join the movement today. It's completely free. Our executive leadership team includes myself, our Vice President, Ashani Johnson-Turbes, Member at Large, Stacey Robinson, and Executive Director, Diane Brodalski. The Society also includes an esteemed group of leaders from across sectors who make up our steering committee and advisory board, and you can learn more about them on our website. Next slide, please. Just a few quick housekeeping items. This session today is being recorded and will be made available on the Society website in the coming weeks. Everyone is automatically muted, but the chat function is open for conversation and connection, and we encourage you to join in. We'll leave a few minutes at the end of the session for a live Q&A. So if you have a question, please submit that through the Q&A function. We will not be closely monitoring the chat for questions. Closed captioning is turned on and available, and you can send direct messages to NORC Tech Support if you have any technical questions or issues. And with that, I'm ready to hand it over to our speakers who are live together from Atlanta. Dr. Ashani Johnson-Turbes, VP and Director of the Center on Equity Research, NORC at the University of Chicago, and Vice President of the Society, and Dr. Amelia Burke-Garcia, who's a Program Area Director at NORC at the University of Chicago. Take it away, and thanks for joining us.
Thank you, Michael. I am hopeful and I am confident that everybody can hear us well. I know that my colleagues will tell me if that is not the case. Welcome, Amelia. We're so happy to have you here.
Thanks so much, Ashani. Thank you to everyone who's attending, and also big thanks to the Society for hosting today.
As Michael said, you are at NORC, where Amelia led the How Right Now campaign for CDC and the CDC Foundation. NORC is a Society member and is one of the largest independent social science research organizations in the United States. I have known Amelia for about 5 years and had the honor of working with her on the How Right Now campaign. And I'm also really lucky enough to not only call her my colleague, but to call her a very dear friend. So that's really great. So we're going to jump right into this book, Communicating Through a Pandemic. And the first thing I want to say, writing a book is hard, particularly during a pandemic, and it can be a pretty complicated process. Tell us about why you wrote this book.
Yeah, so the genesis of the idea for this book really started with, we've been through a lot in the last several years. This has been pretty tremendous for all of us. And as I thought about what I personally had been through, I really wanted to process that a little bit more. And one of the ways that I process that some people process is by writing. And so I started just sort of, writing and thinking about what this has all been like for me and for people I've known, and what has it all meant. And as I was doing this process, I started thinking about other people's experiences and other aspects of what we've been through over the last couple of years. The media messages we've been exposed to, the changes to our work environments, our school environments, the inability to see loved ones or to participate in the activities that we enjoy. And I started to build on sort of just what started as my own experience to include the experiences and other aspects and dimensions of the pandemic and what has happened over the last couple of years. And it is hard, and it was hard. It was extremely hard. I think, somebody said to me early on in the process, they said, Amelia, I think you are too close to this still, because I started writing in 2021. And, I thought, yeah, okay, sure, I am. It is, we're still in it. And yet, as I read drafts of what I was writing, and I would go back to old drafts, I was sort of stunned by the fact that there were things I had written that I had already forgotten about. And so in some ways, I was really happy that I wrote it when I wrote it, because it was still fresh. And it allowed me to document things, maybe not so much as I was going through them, but had recently gone through them.
No, I love that. One of the things that I love about the book is it's not a how, we talked about this, it's not like a how-to book. I mean, there's some how in there, but it is it's a personal story. Yeah. It's a journey, and that I think, and you tell stories, and that makes it really refreshing to read and enjoyable to read as well. So thank you.
Yeah.
Okay, so in chapter 1, you talk about COVID, and you say, quote, "It amplifies the good and the bad." Talk to us about what that means, and particularly share how COVID has done this, how it has amplified the good and the bad.
Yeah, and I think it's probably pretty clear to everyone who's watching or participating today, the bad, right? So the sickness, the death, the disparities that have not just come to light in the pandemic because the disparities have existed, but really this sort of heightened awareness, this heightened consciousness about disparities, the job loss, the job furlough, people's economic stressors, the mental health impacts of the pandemic. All of these things, of course, are the bad sides of the pandemic, and I don't think that should come as any surprise. But I also think COVID, in a weird way, there have been silver linings in the pandemic. So, the idea that we can have our passions reignited, right? This idea of the things that maybe we took for granted, things that we'd love to do and would just easily do, or maybe if you love to play sports or go work out or paint, and there would be nights pre-pandemic where you're like, oh, I'm too tired. I don't feel like going and doing that. I think that there was this awareness of how fragile that is, right? Of not being able to participate in those things. Similarly, the connections with loved ones, with family, with friends, not being able to see them, only being able to maybe see them over, a Zoom or a FaceTime on your phone, talk to them electronically. I think all of those connections to people and to things whom and that we love, those things I think have really become more salient to us. We've sort of recognized the importance of those moments. I also think that the pandemic has challenged us to be innovative and to find new ways to entertain ourselves and to connect with people. And so, caretakers who found new ways to, amidst all of the stress that they were going through, they found new ways to balance all of the things they were doing, new technologies, new apps, new methods to do all of the things that were that they had to do in their lives, for people who were stuck at home and could not go out, finding new ways to engage with one another and not just Netflix and binge all the time. So I think it's really challenged us to find new ways to live and to coexist and to engage with one another, which I think those are all silver linings.
Those are silver linings. And I love it. You tell some stories and talk about that a little bit in the book. I remember during the pandemic, I thought one of the really clearly bad things was that I couldn't physically connect with my family, right? But I also know that what it meant then is that I started having Zoom calls with family members that I didn't talk with on a regular basis every single week. So that finding ways for that kind of connection, the very thing that you're talking about. So yeah, some silver linings.
Exactly.
That's lovely. Okay. So you've already started doing, in the course of this conversation, that which I want you to talk about a little bit more, which is storytelling. And you do it beautifully in the book. in the book, you do a really excellent job talking about COVID's disproportionate impact on historically marginalized and minoritized communities. And you just touched on this a moment ago when you were speaking about disparities. And you give a particularly poignant example of this through Branda's story. That's in chapter 7, y'all. So I would love if you would share with us your perspective on the importance of storytelling to communicate about health, particularly during a pandemic and during a crisis. Talk to us about that.
Yeah, so, storytelling and in health communication, we talk about storytelling a lot. So again, maybe perhaps not brand new to folks, which is a good thing, but storytelling can be very powerful in terms of making data and science and information relevant to people and their lives. It can help with awareness, building understanding, and it can help with people adhering to health behavior change. I like to use storytelling because, first of all, I want to write a book that people want to read. And I don't want to write a book that feels so stuffy or so dry that it lives on a shelf or in a Kindle and it never gets really used, right? I wrote another book before this, and I sort of use the same approach that I want to make this easy for people to read and to enjoy and to get something out of it. And so for me, stories are a big piece of how I write. So there's sort of a structural component to using stories to open up chapters, to set the stage for what I'm about to talk about, or to punctuate data or scientific information that I share throughout the book, to sort of provide examples. I also just think it provides a human face to the things that you're talking about. And so Branda's story is a beautiful story that was shared with me by her, and I was connected to her through Fred Sandoval, who is the executive director for the National Latino Behavioral Health Association. And we worked with him on How Right Now, and I've had the opportunity and the honor to collaborate with him on a few other projects over the years. Branda is a social worker, and throughout the pandemic, I think she actually now has a new job, but for most of the pandemic, she worked in a nursing home. And she also is a wife and a mother and a caretaker, and she's got a granddaughter and a father who are both immunocompromised. And she really talked about what her experiences were like as a mother, as a daughter, as a partner, as a grandma, as the primary kind of breadwinner throughout the pandemic, as a social worker in a workplace where she was caring for people who were very vulnerable to sickness and to death in the pandemic. And in addition to that, struggled with how to support them in terms of their emotional well-being during lockdowns, during, when they could not gather for doing their activities because they were trying to keep everyone separate and keep everyone as healthy as they could be. So just hearing her perspective on so many dimensions, but really was very powerful. But then also hearing from her how she had to make choices, and how those choices to go to work, to provide for her family, to put herself at risk, but to also to take steps to protect her family when she came home. So really trying to limit how, when she would go to work, she would also be the person to do all the food shopping. She wouldn't, knowing that she had to go to work, she was trying to make herself the only person who would potentially bring COVID back into her home. And so coming home and before she even greeted her family, making sure she took all of her outside clothes off and, cleaned, washed her hands, and then sharing just stories of frustrations around, not being able to access certain types of cleaning products or protective, masks or things like that she could wear in her home. Because of kind of what we were seeing happen in the pandemic with both shortages, legitimately so, but also the panic buying and some of the other things that we saw happen.
Yeah. Okay. So I'm going to ask you something that's not necessarily on my paper, but it is related to what you just talked about in terms of as you were telling Branda's story. Because one of the things that you just did really well was you talked about Branda's intersectional
Yes.
identities, right, and her roles, and also about understanding her lived experience as a caretaker, her lived experience as in her profession and in her job. Say a little bit about your thinking about the incorporation of the deep meaning and incorporation of lived experience in research and in communication. And because I know you have thoughts about this because we've talked about it.
Yeah.
So
and we may be slightly jumping ahead with some of the things we're going to talk about in a little bit, but yeah, I mean, I think at the core, right, of and you talk a lot about this in your own work, we don't all start from the same place. Mm-hmm. And so, you know, and I think that has become very clear in the pandemic. And we've seen that play out in terms of people being able to pay their rent, pay for food, worry about daycare, you know, how they're going to take care of their children and go to work, having to make the choice of going to work and paying the bills or going to work and possibly getting sick, right? So all of those things, recognizing that we don't all start from the same place, and we were not all in the same place when the pandemic started. And so really the point of health equity is to make adjustments so that people can thrive, right? And I think that what becomes really important is the incorporation of voices and perspectives for the people and the communities we seek to serve in our work, in our research. And what that means, it is not just a checklist. It is not just, you know, a framework. It's not something that we can sort of tick off and say, yes, we did this thing. What it really is making sure that those voices and those perspectives are the center, and they're the people's experiences and their lived experiences are at the center of what we do, so that the work that we are doing is not just creating messages and putting them out through a variety of channels, but that we are actually in the service of those people, right? The work we do, like, that's why we're here. So I think that, like, I think what you're getting at and what I have hopefully articulated is that we are multidimensional, we have lots of perspectives, and that all of those perspectives come into play as we are humans navigating this world and making health decisions.
Yeah, no, I love that. And so you may have answered a little bit in your response on that last question, exactly what I'm about to ask you. So if this is repetitive, you let me know. But one of the things that Amelia does throughout the course of the book is she talks about the importance of context and consistently drives home in a powerful and meaningful way that context matters. How do you think? So tell us about, like, that phrase, right, that we see consistently, and then at the last chapter, you're like, context matters. I know I've said this, but I'm going to say it again. Tell us exactly, like, in your words now, what that means to say context matters.
Yeah, so the theme of context matters emerged as I was writing this book, and as I was sort of, again, for me, and I can't speak for everyone who writes books, I don't know what their process is, but mine's very iterative. And so as I would work on pieces of chapters and move things around. Maybe this story works better here. Maybe this story works better here. And as I was iterating this idea of just how unique our experiences in COVID. So yes, COVID has been universal. We've all experienced COVID in some way. And we've experienced similar aspects of COVID, right? So we've all been exposed to messages around social distancing, around mask wearing, around vaccination. But what those mean in practice, in people's lives every day, has been different,
yes,
right? And how you think about those things, how you incorporate them into your life or not incorporate them into your life. The media messages that we are exposed to, right? The singular media messages, who we trust for information, what channels we get our information through. Those have all led to very, very unique and diverse experiences, for better or for worse, across the pandemic. Right. And so as I was writing, I just kept thinking, man, context has mattered. It has always mattered. And in the spirit of pandemic communication, there may be universal messages that we want to share, right? Sort of similar protective messages that are helpful to people. What those mean to people is not always going to be the same thing. And so really thinking about contextualizing your messages, localizing your messages, leveraging people that people and communities trust is going to be so key for us as we move forward. And as we think about really meeting people where they are, serving them in their current place and existence, and giving people what they need to be safe and to be healthy, but also to recognize that there are ripple effects and implications of what we ask them to do in an emergency situation, and all of that needs to be taken into consideration when we're creating our strategies and our tactics for communicating out.
It really speaks to tailoring, right? And so not just, we use the language of targeting sometimes too, but tailoring, because for example, Branda gets the message, right? Social distancing. I get the message, social distancing. You or Michael Gridler, whomever gets the way that manifests itself, or the way that plays out in our lives, is going to be entirely different.
Exactly.
Because of our context, right?
Yeah.
Like I'm a researcher. I work at home. I'm not out in the field. So telling me to socially distance is different than it's going to be for a whole bunch of other people. I thought about that so much when I would go get groceries during the pandemic, right? Like they're getting the same frame and the same message that I'm getting, but they became essential workers in the grocery store. So no, very well said. Thank you. Yeah. Okay. Health equity. You have used that term, and I love that you have used that term, and you use it in the book clearly as well. In the book, you state that, and I quote, a call for communication programs, a call for communication programs that can address health disparities, improve negative health outcomes, and advance a mission of health equity for all is significant. What are the key ways that health communication, particularly in the work that you're doing, can meaningfully advance health equity?
Yeah, it's interesting. I had a conversation with somebody while I've been here in Atlanta, and we talked about this idea that it seems so simple, but it is not simple, and but it is so important, which is to talk to people, to ask them what they think about things, to get their input on what they need, and not make assumptions about what they need or how they need it. And sometimes I think, we need to be thinking bigger, bolder, have these smart ideas in health communication, but sometimes it's as simple, and we don't always remember, which is what we have to work on, is part of putting people's lived experiences at the center of what we do means talking to them, including them in the conversation, co-creation of those messages, and allowing for, which is not something also we're very good at in public health sometimes, allowing for people to take our messages and share them in ways that are meaningful and that they know will be more meaningful to their communities than what we could ever know. So I think that, it's kind of what I said before a little bit, which is we don't all start from the same place, and therefore we have to make adjustments. And the only way we can actually know what adjustments need to be made is by communities that we serve telling us what they need, telling us what adjustments that they need, or what adjustments they need. And I think that is just baked in. It needs to be baked into the work we do in health communication. And I think that and again, not all health communication projects are funded at the same level, or have the same timelines, or have the same objectives. But even thinking about bringing partners to the table, even thinking about who are you talking with to inform your strategies is key to being able to reflect back the realities of communities to them, right? So it really does need to be a participatory process in which we are working together to sort out what the right solution and what the right message is.
I think that's great. Okay, so I was writing down some things you said. So, and I share this with the audience listening to us today. So in terms of key ways that health communication, especially in your work, can meaningful advance health equity. 1, engage partners. I heard that. Center the people and center lived experience in the work. Number 3, reflect the realities of the people for whom we are creating frames, concept, and messages. That was number 3. Number 4, co-creation is critical as well. And number 5 that I caught while you were talking is focus on being participatory. Yeah. Would you think that, did that capture? Okay, I tried.
Fantastic.
Thematic analysis on the spot. Okay. It's taking everything I have not to talk over you, because I know when we'll start talking real fast. Exactly. So, okay. At the end of the book, okay, so this is getting to this idea of reconceptualizing communication, because I think what you've done thus far in this conversation is talk about why you wrote the book, why it's important to center people's lived experience, the meaning, what it means to advance health equity, which, by the way, is the mandate of health communication, is to advance health equity. At the end of the book, you talk about your vision for the future of pandemic communication in particular, and you use the word reconceptualization. What does reconceptualizing health communication in the future look like to you?
So I think that there are a couple of dimensions that sort of fall under this idea of really rethinking how we think about health communication in today's environment. And the first has to do with this idea of right now in public health and in health communication as sort of a related field, we surveil, right? We surveil for virus spread, we surveil for infection rates, and that's very important. No one's saying that we shouldn't be doing that kind of data collection. What we don't necessarily do systematically, longitudinally, iteratively is understand what's going on in communities, talking to people, getting a sense of what data has been collected. Is there like a historical archive that we could create? But how do we also move forward with what are some new concerns that might be emerging, or new things that are trickling into conversations that could be problematic when we have a situation and we're asking people to make certain changes? Who are people trusting? Where are they going to for their information? And I don't just mean broad categories of channels, right? So social media, television, radio. I'm talking about who are the voices, who are the influencers, who are those peer-to-peer connections where people get their information and where they go back to for information. If we did that in a more consistent and holistic way on a regular basis, we would have a better sense of what's going on, what are people thinking about, what are their fears, what are their concerns, where are they getting their information and who do they trust? And we wouldn't also then therefore be showing up on people's doorsteps, literally or figuratively, asking people to mask wear or socially distance or participate in research when we meet them only. We would be doing this and building that trust with those communities in a way that allows us to then have a conversation about there's something going on and we need your input, or we need you to take these steps in order to reduce risk for people. I think that there's, a real intention there to understand what's going on. And by trying to understand, you're helping to sort of build those bridges and get to know people and get to know communities. Mm-hmm. And I think that gets to sort of the next big piece, which is living or creating sort of a new communications environment, right? So one where yes, it's nimble. It is not being, there's a scientific process in health and in public health, and I get that, and that shouldn't go away. But we also, as communicators and as scientists that maybe work with communicators, need to understand that how we communicate science in a rapidly changing environment like a pandemic is a challenge, because we want to be able to give evidence-based information out to people, but that information may change in 2 weeks or 2 days or 2 hours. So getting comfortable with the discomfort of not knowing and being transparent about how we communicate about those things is key. It also, though, means, again, bringing people into the fold, bringing them into the conversation, and really not just saying, yes, we use inclusive and participatory communication, but it's really this intention to put people at the center of what we're doing in order to really have an impact. And then I think this gets also to the trust building, which then leads me to the third dimension, which is mis and disinformation. And I think, you know, there's a lot there, and there's a lot that has to do with policy, and policy is going to be different by state, county, country. There's a lot that has to go on in terms of working with big tech, and how big tech operates by country is going to be different. There are power structures at play that have to be considered. So it's a big, messy conversation. That said, I think if we start to take some of these steps towards understanding and working with communities, putting them, you know, inviting them into the conversation and anchoring what we do, like with them in their lived experience, you know, the realities of what people and communities are going through, it ultimately helps build that trust, which is key to mis and disinformation, and sort of source trust. Where do we go for information? Who is credible? And it doesn't solve all of our problems, certainly, because it's multifaceted, but I think that there are different ways to come at it to combat some of these bigger issues. So I do think that there needs to be a reconceptualization of what we do. And there may be other things that others will add to this list, but those are kind of the ones that I have thought about most as it relates to kind of what I wrote about.
Yeah, and I love, and you do that very nicely, like in chapter 3, like those 3 things that you think that you thought about. So okay, so I'm going to do this because we have some. I looked at the clock, and so we have a lot of time. So I'm gonna play with a few things you said. So number 1. Years ago, I remember going to a talk, and it was a professor who talked about health disparities and advancing health equity. And he goes into talking about all these different things. And then he literally says during the talk, and I love the way he did it, he was like, y'all, this is not rocket science. And then he pauses, he's got this wonderful pause, and he goes, this is harder than rocket science. And as you were describing all of that, it is harder than rocket science, right? Like we're dealing with things, we're having to address past trauma and history, and when you talk about trust and all of those things, and so we're also having to unpack and deal with that in terms of, and thinking about also where people are now, and about policy as well. So all of that does make this very kind of complicated stew. Okay, so 1, I want to share that. Number 2, you talked a lot, and now also about reconceptualizing, and it's about bringing people in, right? So you say the ways to talk to people about their fears, their concerns, their trust, and to get to know community. Do you have any recommendations for ways to do that well, like the how? So whether that's community advisory boards, whether that's surveys, whether that's looking at social media, big data, like what are some ways that you think are good ways to do that?
So I think there are a couple of things there. I think from a methods perspective, I'm a big proponent of multi-mode, right? So not all questions can be answered by one mode, right? So we ask different types of questions, and we use different types of data collection methods to help answer those questions. But I also think that how people engage with survey research versus social media, conversations, can unearth different dimensions of, things that we're interested in, such that we can get a fuller picture of what's going on if we're using different methods of data collection and triangulating sources to answer questions. So, and I absolutely think that how we engage, like bringing people in, getting their perspectives, but then also pulling from organic conversations in social media, asking, close-ended questions in surveys that give us sort of the quantitative pieces of things. It all can help build towards being able to understand, you know, what are the things that we're trying to understand. I think a really interesting method that I know that you and others at NORC are doing some really great work on is the use of community boards. And this idea of, again, in the spirit of participatory research, bringing people into the research process to both, yes, inform and answer questions, but also verify that how we as researchers are understanding those data, that in fact, that's how we should be understanding those data. Like, I think that that's an amazing way to both include people in the process, triangulate, it's another form of that, I think. And again, make sure that you know, the things, the messages, the products, the pieces, the data that we're putting out, that it's sound, that they're sound, right? That we're actually, because that's what then we're going to base programs on, policies on. And if we're not starting with good quality data, then we can't build on that with good quality policies and practice.
Yes. Yeah, you see me itching my hand up because I'm like, don't talk over Amelia. All of the things you just said, yes, and related to reconfirm. So yes, community advisory boards, but even this idea of like reconfirming, I don't even know if that's the proper word or a word, but our colleague, Dr. Chandra Jones, is doing really good work and talking a lot about data parties. So, right, so bringing people in on the front end in terms of community advisory boards or advisory boards, whatever we want to call them, in terms of conceptualizing how we collect the data, but also how we analyze it and how we interpret it, particularly in the space of health communication is important because we're putting out these messages that are affecting people's health protective behaviors. And the rest, so I'm glad that you said that. Thank you very much, Amelia.
Well, and I'll add one more point there, right? Which is, again, thinking about all of the touch points along the research and communication process where you can create feedback loops.
Yeah.
And that's, again, like you said at the beginning, but also during the analysis portion, it's also in sharing the data back with the communities that gave us the data to begin with. And so I think that's something in science that, you know, for a variety of reasons has not been done very well. And I think if, you know, one of the things that we've tried to do in How Right Now, and many of the other, I think, health communication programs that we work on, is this idea of what can we give back, right? What can we, because at the end of the day, these are not our data. These are data from the communities that we're supporting. So, you know, I think, again, this idea of ownership and including people in the process so that they can feel ownership of these projects is going to go a long way in terms of what we want to achieve as public health professionals and health communicators. It's also going to be better for communities in terms of the policies and programs that are then used in those communities.
Right. It is. So this reconceptualization also involves shifting power. It's addressing those power dynamics and shifting power as well. Okay, so I want to give the last word to Amelia. So the book is a needed challenge to all of us who are doing health communication and communication science. And I want to give you the last word to share with us any takeaways that you have.
Sure. So I think the thought I will leave this session and this conversation with is that, like, we're a village, right? And we are, and I use this analogy at the end of the book that, you know, we're a small group of people, relatively speaking, and we are working towards a common purpose, right? Which is better health and thriving for all of us. But we also are a small village with the weight of the world on our shoulders. And we saw this in the pandemic, that how burnt out our healthcare workers became, how burnt out our public health professionals became as the pandemic wore on. And we have to do better. We do better by us and by all of the other people in our village. And I think that really requires an investment in training. We need to better train our professionals, and we need to do ongoing training and allow people. We are so busy. I think everyone who's probably participating today is multitasking, because yes, the conversation is interesting, but we have so much on our plates. And I just really think that we have to allow our public health professionals to train more and train on new things that are emerging, so that they can better address some of the challenges that they face: misinformation, health equity. How do we do participatory research? How do we start to really affect these changes at the local levels, right, in people's everyday jobs and communities? I also think it requires a commitment, like a big anchor of resources, right? We can't do this. We can't do this work effectively. We cannot engage people the right way without the right allocation of resources. And then I also think that means we need to bring the right people to the table to say, what do we need, and how do we need to do it? So I think there's a couple of dimensions that need to happen to make all of this achievable. But at the end of the day, I would say we all have to strive for these things, and we have to keep fighting, because this is, what else are we here for?
Right. This is our lives.
Yeah.
I'm glad you brought up resources. That's important. Thank you so much for joining us here at the Society for Health Communication to talk about your latest book. I love saying that. Communicating Through a Pandemic, a Chronicle of Experiences, Lessons Learned, and a Vision for the Future. Now we're going to take some time and take any questions that have come in through the chat, but through the Q&A, and I am going to invite my colleague Mabel Frank to come on screen and share with us any questions that have come through. Hi, Mabel.
Hello, thank you so much. So yeah, let's hear from our audience for some questions. So the first one that I saw come in was a question about preprints. So preprints and various archive sites have been a keystone of the open science movement for increasing transparency and public impact in research. But during the pandemic, they were also a source of half-baked takes that increased mistrust and misinformation. Is there a way to have the good without the bad?
Well, I think that, this is a bigger conversation, I think, about the publishing industry overall, right? And sort of access to data. And there is a push, I think, in science to publish, and that has created this churn of a variety of platforms for sharing, the monetization of those platforms and of information. And certainly, we're here talking about a book that is for sale. So I am all for, sort of the right method to sort of share and monetize information. But I do think that there becomes the risk of not great science being put out there. And I think that we need to do a better job of working with publishers, and of also, like, from this community being involved in, like, the peer review process and in the editorial process, to be able to sift through what are the things that need to be put out, and what are the things that maybe are not really going to do the best job. I will say, though, that it becomes increasingly difficult as we live in a digital world where anyone with a platform and an audience can be considered credible. And so this gets to issues of trust and of source credibility, of digital literacy. And I do think that there's a lot of work to be done there. I do address a little bit of this in the book as well. And I think that goes to some education, some training around digital literacy, but it also goes to conversations around policy and how do we navigate sort of the massive amount of data and information that is out there, and know what is verifiable, what's not so much.
Thank you.
Yeah, thank you. I know it was a big question, but wanted to throw it your way. Another question that we got in was about the role of inclusive language when communicating COVID-19 related content. Do you see inclusive language as a part of health equity efforts?
Absolutely. I mean, Ashani and I were just talking about this yesterday.
This morning.
Yeah, this morning. I do think that it is really, really important to be thoughtful about the words and phrases that we use. And again, even within the context of one particular subgroups are, communities are not monoliths. And so being really thoughtful about how things can be conveyed, but that meaning for one group is not going to be meaning for another group, it does make it very complicated. It goes to the same, in how right now we did work around not translation, transcreation. Right. And so creating things new in languages other than English, right? So it wasn't just a word for word translation, but really taking into consideration cultural nuance, how people perceive different types of words, how words can have deeper meanings or like layers of meanings within communities. I think that it is incredibly important to do that. And that's also a place where partnerships and co-creation can really be valuable. And because I think sometimes in health communication, we somehow feel like we need to know everything. And I don't think we do. And we don't. And so again, leveraging the expertise of others to help guide the process will end up with a better product ultimately, but also it takes the burden, I think, off of the program people to think that somehow they have to have all the answers how could they?
Right. And I would even add to that what is inclusive language is changing, right? And it's going to keep changing. I think that we as health communication scientists, researchers and scientists have to stay abreast of and keep our finger kind of on the pulse of what is and will continue to be the most inclusive language. There are some really valuable resources out there. So I think it's the APA has a site on inclusive and equitable language. CDC has a site also on preferred terms that I go to almost probably every single week. So there's definitely some other, and there are a few others as well, really good resources for checking oneself on using the most up-to-date and inclusive language. Any other questions, Mabel?
Yeah, so do you have any observations or notes on how information fatigue impacted institutions or organizations' abilities to communicate necessary information or messages to their audiences?
Off the top of my head, I don't have anything that I would share, that I could direct people to. I certainly think that I reference in the book, this idea of cognitive bias, and it is in part of our human behavior to look for things that fall within our worldviews, that support the things that we already believe, that make it easy for us. There's sort of heuristics make it easy for us to process information, and that leads to cognitive biases. That said, I think, I don't have sources right off the top of my head, but there's certainly things in the book. And then, there are any number of sources online, I'm sure, that you could find, whether that's, some of the work that Pew has put out, or even some of the work that's been put out by Kaiser or others in terms of information overload.
Thank you, Amelia. I think we have time for one more question from the audience. Mabel.
Great. So one last question. With co-creation, can you describe how that can be done with limited resources without limiting the effectiveness? Rarely are there true resources if we think through translations, different languages, communities, and translation vendors.
Yeah, that's a great question. I think that co-creation sounds harder than it has to be, and it's certainly depending on your amount of resources that you have for a project. You can do more or less, but I would, at a very basic level, engaging a set of partners to meet with you regularly to kind of create a feedback loop. And again, on how right now we were moving very quickly. And so our partners were engaged with us quite a bit in the beginning, but as the campaign launched, and then we were looking forward to see what were we going to need to create as the pandemic continued on, we met monthly with them, right? And they shared back with us, here are some of the things we're hearing on the ground with our communities. And then we were able to kind of take what we were working on to reflect that and then run those ideas by them. So it created, being able to put in place a once a month meeting or a quarterly meeting, depending on your timeline, allows for a check-in, allows for some sharing back from the community with the program, and actually doing some informal testing of what you're working on, so that you can then continue to refine before you roll out. So I think there's probably all different levels of that model, and certainly other types of ways that you can do that if you've got money to do ongoing. You could do waves of surveys, you could do waves of online focus groups, all sorts of things like that. But at a bare bones level, just having a set of partners that makes sense to have on your project and engaging them on a regular basis could be quite valuable and meaningful to the project without incurring a ton of resources.
Yeah, and I recall that you did that really well at the beginning in the formative phase for How Right Now. So thank you, Mabel, for the questions. Thank you, audience, for asking questions as well. Thank you, Amelia Burke-Garcia, for coming and joining us today. At this point, I am going to give the floor to President Gorilla from the Society for Health Communication, because he is going to do the closing and also the fun part we promised you at the beginning, which is a raffle. So thank you so much. The floor is yours, Michael.
Thank you. Thanks again. Thanks to Ashani and Amelia for this insightful conversation. Really interesting and great points for our health communicators. Thanks again to our organizational partner and webinar sponsor, NORC at the University of Chicago. And also a big shout out and thank you to Mabel Frank and Heidi Kellison at NORC for all their efforts to make today happen. Next slide, please. Really quickly, we're going to make a plug for the annual summit, which is on June 12th and 13th in Austin, Texas. This year's event is centered around the intersection of clarity, creativity, and equity, where we'll discuss trends in health communication, the role of storytelling in public health, the truth behind misinformation, the critical role of cross-sector engagement in communication, the intersection of public health and climate change, and much more. In addition to the full day of sessions on the 13th, we will host several in-person educational and interactive workshops. So we really hope to see you there. I'm going to send a link in the chat in a second, but let's get on to the raffle. All right, so Mabel is going to help us identify 3 lucky winners who will receive a signed copy of Amelia's book. So let's go ahead and give it a spin. Braniki Floyd is our first winner. Congratulations. Anthony Otomi Manye is our second winner. Congratulations, Anthony. Next and final spin, please. Julie Pedruska is our third winner. So congratulations to all of our 3 winners. We'll be in touch to collect your addresses and we will mail them out to you soon. For those of you who didn't win, we encourage you to go ahead and buy Amelia's book. The link has been shared in the chat to her website along with a 20% discount code. So please check that out. Next slide, please. Okay, so just to wrap us up, I think thanks everyone for joining. Reminder that today's webinar will be posted to the Society website in the coming weeks. We ask that you please complete the post-event survey. You can learn more about the Society and also check out previous webinars on our site, follow us on social, or feel free to reach out to me directly. Thanks everyone for joining and take care. Bye.